promised, this is my top 5 questions that I get from patients. Question number 1, what supplements should I be taking? I get this question a lot. Almost every visit, somebody is asking about how they can supplement their current nutrition and lifestyle routine to enhance it and get the results that they're looking for. So this is an individualized question. It depends on the patient, what their current health goals are, if they have any current health problems, and if there's anything that we're trying to correct for, such as high stress, high or low cortisol, difficulty sleeping, weight gain, weight loss. So this is definitely individualized, but there are some supplements that in general most adults can take safely. Now, these would include things like a high-quality multivitamin, a vitamin D supplement, magnesium in the evening, and an omega-3 fatty acid supplement. In general, this is a core group of supplements that would benefit most adults regardless of what their personal health goals are. Now, of course, this does not constitute medical advice. I'm not your practitioner, but these are things to look into and see if they would enhance your current health and help you to make progress towards your health goals. When selecting supplements, I do recommend that you look for supplements that are high quality, that have high bioavailability, that are easy to digest and absorb, that are free from genetically modified ingredients, fillers, gluten, dairy, and soy products, especially if you have sensitivities to any of those things. When it comes to multivitamins, it's also important to know if you have a condition called MTHFR, which is a genetic mutation that affects how your body methylates your B vitamins. This can make a difference in what multivitamins are going to be most effective for you. So this is a test that I would recommend having done to find out if you're a person who is challenged by over or under methylation before selecting a multivitamin. This could definitely impact how well your body tolerates the multivitamin. So when it comes to knowing what supplements you should be taking, big picture, I recommend talking to your practitioner, finding out if you have any particular health characteristics or genetic mutations that may affect how your body metabolizes vitamins, and then choose high quality supplements that are free from contaminants and other components that may be irritating to your system. The second question that I get very frequently from patients is, how do I know if I'm in menopause? So menopause is defined as the time at which a woman has gone 365 days without having a menstrual cycle. Now, this can be really confusing because some women don't have menstrual cycles regularly anyway, such as women with polycystic ovarian syndrome or other hormonal issues that can affect the regularity of their cycles. This can also be confusing for women who've undergone uterine ablation, which cauterizes the lining of the uterus and can prevent menstruation, even though hormones are still cycling in the woman's body. This can also be confusing for women who have technically achieved the point of menopause and then may have some breakthrough bleeding after that 365 days with no menstrual cycle. So there's a lot of variation there. But in general, the answer to this question is when you have gone 365 days since your last normal menstrual cycle. Now, there are some tests that we can do to evaluate your status as to whether or not you are post-menopause or whether you have any kind of ovarian function still going on. So looking at your follicle stimulating hormone level and your estrogen level can give your practitioner insight into how close you are to menopause, if that time has come, and whether or not you may benefit from hormone optimization therapy. The third question that I get really frequently, especially from women, is if I start hormone replacement therapy, do I have to continue it for the rest of my life? Now, I approach this question as a very personal question. The decision to start hormone replacement therapy is individualized. It depends on each person's preferences, values, and how they view their health and their health span. Now, beginning hormone replacement therapy for men or for women can alleviate uncomfortable symptoms of hormone deficiency. And that's the main reason why many people seek out hormone replacement therapy or hormone optimization therapy. However, hormone optimization also benefits longevity and can help you to continue functioning well and feeling your best into the decades to come, whether it's your 60s, 70s, and onward. For me, personally, I don't see a reason for somebody to be required to stop using hormone optimization therapy or hormone replacement therapy unless there is a medical indication that contraindicates that particular hormone being used. Now, that's going to depend on each person's particular health profile and what health issue they're experiencing. So that is a decision that you have to make as an individual and discuss the risks, benefits, and alternatives with your healthcare practitioner to determine what route is best for you to take. But in general, the decision to start or stop hormone replacement therapy or hormone optimization therapy is a personal decision that is best made based on your personal beliefs, preferences, what you hope to get from your healthcare, how you view your health, what you plan for yourself as far as your lifespan and your health span, and what your personal health characteristics are, and if there are any risks that should be mitigated in that process. That's a conversation to have with your healthcare practitioner, and I definitely recommend seeking out somebody who is well versed in hormone replacement therapy and has a lot of experience in that area. The fourth question that I get really frequently is, are GLP medications safe for weight loss? And then as a follow-up question, oftentimes I get, and will I gain the weight back after I stop using them? And so GLP medications have been on the market for a really long time. So first generation GLP medications started with liraglutide. We have semaglutide, tirzepatide, and then some other medications that are going through the FDA approval process. Many of these medications, just like any other medications, do have side effects, but in general are very safe for use when used appropriately for weight loss, in conjunction with a comprehensive nutrition plan and lifestyle modifications and exercise. I look at the use of these medications as being like training wheels on a bicycle. They don't pedal the bike for you. They're there to help you so that you can continue making progress towards your weight loss goal and give you some guardrails and some boundaries so that it's easier for you to make healthy food choices, optimize your nutrition, stay consistent with an exercise program, and then engage in regular medical monitoring to make sure that you're staying safe while you're using them. I don't think that these medications should be used in a way as a substitute for healthy diet and exercise and modifying your lifestyle to ensure that you have a healthy environment around you to support that weight loss. If you do not make healthy nutrition choices, lifestyle changes, and engage in a routine of regular exercise, then I do see that those patients who don't do that during the course of time that they're losing weight on these medications often will gain the weight back because they didn't do the work while they were on the medication to establish the healthy habits necessary for long-term weight maintenance. So hopefully that answers those questions for you. The fifth question that I get is really pertinent to today. We have lots of information in the media right now about cortisol, and is cortisol good? Is cortisol bad? How do I lower my cortisol? So how do I lower my cortisol level is a question that I'm getting a lot more frequently lately. Now, there are ways to lower cortisol, but the first question that I ask my patients in response is, do you know what your cortisol level is? So a lot of times we don't know. And so I would preface that conversation with, I think it's reasonable to have your cortisol tested. And my preference in my practice is to look at a salivary cortisol and to test cortisol at multiple points during the day, because there can be variations in cortisol throughout the day, with a normal cortisol curve having high cortisol first thing in the morning upon awakening that comes down through mid-morning and kind of tapers off throughout the day and comes to a low point around 9 p.m., 10 p.m. so that your cortisol cortisol is low in preparation for bedtime and falling asleep. So that's the trend of what a normal cortisol curve would look like for somebody who is awake during the day. Now, people who work night shift or are on different schedules, their cortisol curve may be different from that. So, but optimally, that's what would happen for somebody who is awake during the day. Now, a few things that I see happening are people who are under high stress, especially occupational stress. They'll have a really high cortisol right before they go to work and a really high cortisol when they come home from work. For some individuals who've experienced prolonged periods of intense stress or several repetitive stressful events over the course of a period of time during their lives, they may have a very low flat cortisol that doesn't ever really rise much above baseline throughout the day. And so knowing what's happening with your cortisol can really help to direct treatment and help your practitioner come up with a comprehensive plan to help you get your cortisol back into the normal range. And this is really important. Cortisol is an important hormone that helps us to respond physiologically to stress. So lowering a normal cortisol is not helpful, and then raising a high cortisol is not helpful. So knowing what your numbers are first will help you decide what course of action needs to be taken to modify your cortisol so that it's consistent with good health and good functioning. So these are the top 5 questions that I get most frequently right now in my practice. And just to recap, those were: what supplements should I be taking? How do I know if I'm in menopause? If I start HRT or hormone replacement therapy, do I have to continue it for the rest of my life? Are GLP medications safe for weight loss? And if I use them, will I gain the weight back after I stop using them? And then the 5th question was, how do I lower my cortisol level? And of course, the responses to all of these questions are based on the individual and definitely warrant a comprehensive health evaluation by your practitioner before deciding to embark on a plan for treating whatever your health concern is. So I hope this information's been helpful. It's always my pleasure to answer your questions. I would love to know what other questions you have. I will be happy to answer them to the best of my ability. And just be aware that these are my personal opinions and my approach on how I address my patients' individual needs. This does not constitute medical advice. If you have questions about your particular health situation, I definitely encourage you to seek the advice of a qualified healthcare practitioner, somebody that you know and trust and has experience in the area that you're concerned about. Otherwise, take care. Have a great day. It's a pleasure talking to you, and I'll talk to you again soon.